in the summertime, kids are spending more time inside the house. And I think it's important to remind folks to make sure that things inside the home that can be dangerous to kids are kept in a secure location. One of the things that we have seen an increase in our emergency department is children who have ingested marijuana substances, marijuana edibles, food products made with marijuana. Because marijuana products are not regulated by the FDA, they are not coming in standardized, secure, child-proof containers. And many times those marijuana edibles are gummies. They look like gummies. It looks like candy. And so we have children, toddlers, who see that, it looks good, and they eat it. It can cause very significant injury and illness for kids. I've seen children come in, with not breathing well because their drive to breathe has been down because they've been so severely sedated from it. Kids can have all kinds of confusion, psychosis. It can make them very sick. Please, if you have marijuana in your home, it needs to be in a locked container in a place that the child cannot access it. The lock should be fine in case they do in case they do find your container, but it really needs to be in a secure locked container. The same can be said of any adult medications. The vast majority of prescription drugs have a childproof top on them when they come from the pharmacy. However, many people take their medications and then will then put them in like a pill box or in a different container that maybe doesn't have a childproof top on it, and they'll keep them understandably in a place that they'll remember to take it, like on a counter or in a purse. Kids very frequently end up getting into those medications, some of which can be very, very dangerous to kids with even the ingestion of one tablet. If your child has gotten into a medication or into a substance in the house, please call the Poison Center. The Poison Control Center is a great resource for families. They are always happy to talk with you. Even if you think a child might have gotten into something, there's many situations where, the parents are like, I think I should have this many pills and I can't find the other ones, and I'm not sure if the child may have ingested them or not. Call the Poison Center. It's a free, easy phone call, and they can tell you what your level of concern should be and whether or not you need to come into the ER for any additional interventions or observation.